the theme of this is still the world around us. And you'll see there's lots of worlds around us, not only from a science perspective, but where it really matters at the community front line. I'm honored to introduce, or actually I'm letting them introduce themselves. So each of our panel members will spend 2 to 3 minutes introducing themselves, the area that they work, and the meaning of their work for women's health. So let me start on my right. Yes.
Well, thank you. It's an honor to be here, and thanks to Yael for inviting me. I've known him for years, and it's such a pleasure to have heard the speeches before us. I was really energized by Dr. Solomon's speech because she did not mince words on the dangers that we face and the role that corporate America plays in those dangers. I am from the Robotics Institute at Carnegie Mellon University, Robotics Institute. So that means I am less knowledgeable about health than pretty much everybody else in this room. I'm at a place called the Create Lab. And what the Create Lab does isn't that we are knowledgeable about health as you are, as physicians. We are tool makers. And we create new ways of understanding and deriving known from the unknown. How do we take hidden information and make it revealed? We do this, for instance, by building laser spectrometers that we put around the fence line at the Shell cracking plant in Beaver here to show multiples more toluene and other volatile organic compounds in the air than is legally acceptable. We do it by creating detectors and by storing and then visualizing all data from all air quality detectors in the entire United States for the EPA. We do it by taking a model of how turbulent air flows around smokestacks from the National Oceanic and Atmospheric Administration. We combine it with all demographic data that the United States Census has, and then working with both of those agencies, we're able to layer the two on top of each other and show how toxicity of air across the United States disproportionately impacts persons who are marginalized, protected classes. And that is the kind of work that we can do. Now, that's what we do. Why we do it, I think, is worth speaking about as well. The reason we do it, which goes back to what Dr. Solomon was talking about, is that we live in a world where data is held in a hegemony of power by government, by corporation, by those who have conflicts of interest with the communities that are most affected and most vulnerable in our environment. And so what we wish to do in the Create Lab is to invert the hegemonic structures of power in society. We do that by working directly with community-based advocacy organizations and making the data available to them so they can advocate for the changes they need. Thank you, Yael. So it's blinding, but I can tell. There's something unique about Yael. He has a joy that comes through the lights. So for example, there was a Coke plant here in Pittsburgh, and we work with Allegheny County Clean Air Now over the course of years to help them show clearly daily violations of smoke released from the Coke plant. Once we got the Shenango Coke plant closed, the health department here did a study. And of the 70,000 people living within a couple of miles of that plant, there was in a single year a 45% decrease in cardiovascular disease reports and a 40% decrease in pediatric asthma. In 1 year from closing one plant in Pittsburgh. The effects that you can get are tremendous, but nobody does it because the information is owned by the structures of power, by the anchor institutions. So just very briefly, that ability we have to model and track plumes of toxicity as they spread, kind of like a river through communities, is based on pretty massive statistical machine learning. And that's work that we have done by combining forces with the Environmental Defense Fund. We've done that in Los Angeles, in Houston, Boston, and here. Anywhere there's petrochemical refineries where we can show volatile organic compounds spreading into people's lungs and affecting protected classes. This week, I'm pleased to say, as a sneak preview to you all, that in Brazil, EDF is going to release a version of our system, I think on Thursday, where any resident of Brazil can click on their location, and it'll show them all of the maximally likely sources that are actually polluting their air. So which industries are directly polluting their air. And then at the end of the week at COP29, Al Gore will be using our interface on Friday to show in Azerbaijan inequitable disproportionate disease burden from the toxicity of air chemicals in the US, in South Africa, and in Poland. We did those 3 studies just over the last couple of weeks. And last but not least, this week, the Black Equity Commission here in Pittsburgh is going to be showing our data on Wednesday. Is that today or tomorrow?
That's today.
That's
Today.
Okay, today. To show that persons of color in Pittsburgh have twice the likelihood of living within the toxic plumes off gas from all the industrial power plant emission sources that we have just in Pittsburgh. So fundamentally, that's a very long introduction, but the idea is that we're the tool maker. We want to empower you to empower the communities to actually take control.
Thank you. So this is an excellent example of making science, making data work for communities. That's my motto too. Great, thank you. Mike.
Wonderful to be here. I'm Mike Boninger, and I have the pleasure of working as part of 2 offices that did not exist at University of Pittsburgh and UPMC as of 2 years ago. And so 2 years ago, UPMC formed a Center for Sustainability. One of the first actions that Center for Sustainability took was to sign on to the Health and Human Services Pledge, which was to decrease our carbon footprint by 50% by 2030. As you heard from Dr. Solomon, but warrants repeating, 8.5%, and I've seen some numbers where it goes up to 10%, which would be relative to the audience, of greenhouse gas emissions are from the healthcare sector, and then if you add in healthcare research, it can go to 10%. And so our job at the UPMC Center for Sustainability is to make that change happen in our healthcare system. We're proud of what we've been able to achieve. We have banned desflurane. Dr. Solomon so well set me up for some of our talking points, and we are working on every aspect of the UPMC's, 42 hospital operations, 600 outpatient locations to try to achieve that goal. The University of Pittsburgh office opened an office of sustainability in the health sciences. Actually, Maureen was instrumental in getting that office to be across the health sciences, so includes schools of nursing, dental medicine, pharmacy, health and rehabilitation sciences, and public health as more of an advisor, a group that helps us all move forward so that we can teach the next generation of providers how to provide care that is more sustainable so we are not part of the problem, and also how to deal with all of the medical complications which were outlined so well this morning. I will tell you that both of these offices, I said, came about in the last 2 years. Dr. Woods and Dr. Artson, who you heard from previously and chairing a session this afternoon, were part of a group of physicians that made that happen, right? So it was activism by a group of physicians saying, how can we say that climate change is bad for our patients when we are 10% of the problem that is leading to climate change? We have to be a leader in this area. And the fact that we have both the high moral ground and the ability to talk to our patients who still trust us and our employees about this issue means that it's a kind of a moral imperative that we do so. I think we also have to do it in a way that's activating, which is part of, I kind of felt great about a role that we can all take, so I don't need to quit my day job doing research in order to have an impact. And that's why I like to tell you about the research mission being part of the footprint. Each one of us can continue the vital work that we do in women's health or in other areas while decreasing our carbon footprint, which helps us, at least helps me, sleep a little bit better at nighttime. And so I will end there and look forward to being part of this panel.
What you didn't mention is that the University of Pittsburgh and UPMC are part of the National Academy of Medicine Grand Challenge.
So the Grand Challenge, the National Academy of Medicine, which will continue this mission on through January, has a grand challenge, which I actually think was again part of Dr. Solomon's slide, to decarbonize the healthcare sector. And we are part of that. We are a member of the working groups, and that is an industry and academia and distributor activity that we think can make a real difference, and we're proud to be a part of it. Thank you for
and I'm proud
reminding
of us.
me.
Yeah. Jamil.
Hey, good morning. I'm Jamil Bey. My work in this space started with, we started an organization called the Urban Kind Institute, and it was a community-based think and do tank, where we sort of started by translating research for community use and helping, some of the good work, not the people in this room, but typically academics do not communicate well to communities, and a lot of work that they do is not able to be activated. And so we said we can activate a lot of this work by helping to make some of those connections. And that work evolved into building relationships in the communities, a lot of the communities that the Create Lab serves, a lot of communities that we serve, that help to bring those scientists into the space, listening to the community, what are the research questions and challenges that they see and have, and how do we then work with with academic partners to work with communities to get some of those questions answered. A lot of that work brought me in, I do work in climate, environment. We do a lot of work around trees and the health of the urban forests and food systems and urban agriculture. And in all of that work, the consistent theme that we have is there are people in the communities that are doing work, there are researchers that are doing work, but there's still not that glue that holds us together. That brought me into relationship with this person, who you're going to hear from next. I'm not going to take her introduction. In work that we did with the Pittsburgh study that sort of gave us that platform where we have communities and researchers and universities working together as partners in so much of this work. And I'm a geographer by training. The first law of geography is that everything is related to everything else. Only near things are more relevant than distant things. There is no second law of geography. And so when I work with families, and I've told this story last night, when we talk about issues, and there's a family in the Homewood neighborhood in Pittsburgh, and the 5-year-old is missing school pretty frequently because her asthma is flaring up more and more often. And it's because her basement is damp, because there's old housing stock that in the communities we've not invested in, and the stormwater is not managed well, and the storms are more intense because climate change is impacting us in that way. Her parents have to miss work to take her to her appointments. They're falling behind, in their promotion ladder, and she's falling behind in school. All of these systems are connected, all of these things are related, and we're not solving problems for that family because we're still working in isolated buckets and not thinking about, well, what's the big picture here? How do we get work done? And so my work now in doing this work in this advocacy space and building credibility in this space, the mayor asked me in March if I would take over as the director of city planning. I'm like, that's not my work. And after a conversation with the mayor, he convinced me we have a chance to put policy to so many of these things that you've been talking about for a long time. And so I jumped at the opportunity at that point. And so now we're working on a comprehensive plan to create a vision for Pittsburgh 2050, grounded in climate and environment justice, and an all hazards mitigation plan grounded in climate and environment justice. And so with those two tasks at hand, I'm at least excited about working in government.
And you didn't mention, Jamil, that you are your organization, it's a learning mess for all of our students as they learn from you every summer. So thank you for letting our students learn.
Sure.
Liz.
Awesome. Well, precious good morning, all of you. And this is so good for my soul. So happy to be here with this esteemed panel. So Liz Miller, she, her pronouns. I'm an adolescent and young adult doc, and you're like, what is she doing on this panel? I am also the medical director of community health at Children's Hospital of Pittsburgh, and have been engaged in community partnered research for my entire career. And so, as Dr. Bay was alluding to, the two of us have been stirring all kinds of pots and causing all kinds of trouble for the last 6+ years now a project, an initiative that was started by my fabulous boss, Dr. Terry Dermody, at UPMC Children's Hospital in the Department of Pediatrics now in 2018, where we envisioned a collective impact initiative to support child thriving and racial equity in our region. So the Pittsburgh study is not really just one study. It is a collective of what we call research practice partnerships. So this is really, as Dr. Bay was talking about, bringing university, community, government together so that we are actually using data to help solve problems and becoming better at listening to community members about the importance of thinking about community-created solutions. So the Pittsburgh study sort of initiative goes from pregnancy all the way into adolescence. Every one of our scientific committees has a community leader and a professional scientist working shoulder to shoulder, and greater than 50% community member representation on all of our scientific committees. This changes the way in which we think about, talk about, do our science. And there are sort of three key threads that run through all of our work, which is, one, communities have expertise, wisdom, strengths, beauty. And that is really like utmost helping community members participate authentically in this science. And we use strategies like making sure that community members are compensated for their time, as well as doing more intensive workshops like community partner research ethics training, as well as data literacy workshops to really ensure that this is not a community advisory, but in fact, community members deeply involved in the science. Second part of the Pittsburgh study is working on building the trustworthiness of science. We all understand how much erosion there has been in terms of trust in our institutions and trust in science over the last number of years. And so working with researchers to build their skills in partnership building, being better listeners, thinking about designing research for impact. And then a third area of the Pittsburgh study has been an insistence that we build the science of thriving. It is not enough in our region to focus on reducing infant mortality, reducing the impact of lead, reducing the impact of all poor air quality, that we need to be setting the bar higher and focusing on what is needed for our children, young people, and families to thrive and flourish. And it is really exciting that there's now a federal interagency initiative called the Vital Conditions Framework, which for the first time lifts up thriving and flourishing at the federal government level. And we're really, with the Pittsburgh study, echoing that work around the science of thriving. And so I will pause there and just say at a very, very concrete level, what I have learned in the work that we're doing in the environmental justice space in the Pittsburgh study is what Dr. Bay was talking about, which is it is all interconnected. As a pediatrician, I was really trained, we think about like doing the lead screening, but not necessarily thinking about all of the social and political drivers of health. And we unfortunately continue to use children as the canary in the coal mine around lead and lead exposure. And so it's a child identified with high lead exposure. We have very, very clunky interventions, which often include saying to a family, we're going to have the health department come in and investigate your home, right? Which is frankly terrifying, but also in our region has resulted in families facing eviction and losing their house. And so that these are all interconnected, that we can't actually talk about lead exposure without talking about affordable housing and housing stability, as well as eviction mitigation, as well as how do we actually change the narrative so that we're not talking just about lead toxicity and home investigation and all of these things that feel intensely carceral, but working with communities, working with our families to really figure out how we co co-create solutions around high lead exposure and protecting our children. And I will stop there.
Thank you. So in the next 20 minutes or so, I have a question for the whole panel, but then we'd like to hear from you and have that dialogue that Joel talked about. Now, the task that Joel gave us this morning was to make sure that there is an area of science, an area of knowledge that we need to address after this fantastic summit. So Ilya, if we look across the lifespan of women, where have we made the least progress, and what should we do about it from your vantage point?
You know, we heard eloquent references to parts of the lifespan of the woman, but it's not the lifespan in a chronological sense. It's the small holding farmer who's being put out of business by large holding industrial agriculture in Africa, and I've seen that personally. It's disease mitigation in places like Uganda, where I saw the Gates Foundation drilling wells that summarily broke within 3 weeks because there were no spare parts. And then the women were walking an hour and a half down to the river and then walking back up barefoot, and then worms go in your feet. You know what happens from there. And all the way to, of course, the question of particulate exposure, which Yael himself and many others have done research on, and the way we can see the direct impact that has even at the placental level. So it's systems engineering, right? If all the problems we face, and what we just heard Beth talking about is that it's not a single silo of knowledge or application area. It's the entire kind of socioeconomic system that we've constructed, and it essentially invades the health of the woman at every step, at every stage, from nutrition to the stability we can have from clean air, and then the joy that I think earlier we talked about that derives from vitality, from you know, the quality of life that we need to actually be able to function fully. So unfortunately, it's death by 1,000 cuts. And that also means there will not be a single point solution. We have to change the values and the value hierarchy in society. And obviously the last week hasn't shown any hope to me that we're on a path to doing that in a good way.
So I am hopeful. I also have tremendous resolve and resilience. We're going to make it.
Good.
But what you're saying is that transdisciplinary work is no longer a luxury, right? It's a must, and it must be done through a systems-driven approach. Mike, where have we made the least progress, and what should we do about it?
You know, it's hard not to bring my own lens to this, right? I think that one of the problems we heard about the ivory tower this morning is if our ivory tower is part of the pollution problem, how do we stand on the top of it and talk about how, you know, and tell the other, you know, tell everyone else that we have to fix this, right? I do think that the results from this week mean that we have to internally reflect on this and talk about what we need to do better. And that, I think we really need to, I'm trying to remember whose slide it was that had the ivory tower on it, but we really need to break that down and start fixing, you know, so I mean, there's obviously informed by my position that I'm saying that we need to decarbonize, we need to take the actions in our own backyard, advocate at our own institutions, and you know, and in the end, because the population's impacted, and we heard eloquently today how women are impacted more, right? Then as we do that, then at least it's part of the 1,000 cuts, and it's our own backyard that we can say that we've made progress in, and we haven't done enough yet. But there's a place where we're heading in the right direction, and we have some more control.
Yeah. Don't accuse somebody else if we need to do our own homework. That's the message here. Jamil, where should we go next?
Where should we go next? I think we need to do a better job of communicating the learning from the information that we're gaining. And Liz and I talk a lot about, you know, ways of knowing, and academic research is a specific way of learning and knowing, but so is lived experience.
Yeah.
okay? And folks who don't have much academic training know quite a bit about their experiences and how to manage those spaces. What we do a poor job of is supporting those communities by translating and, well, what does this mean? And so, if we think about communities that live in the Mon Valley and it's a bad air quality day and seniors and children are vulnerable, okay, what does that mean? What should I do? What does that mean for my, if I'm carrying a child, what should I do differently now that I know that there's a bad air quality day? We talk, now someone brought it up earlier, we didn't used to experience wildfire smoke here. We do now. There are current wildfires burning, locally and region. What does that mean for children? What does that mean for families? And how do we act on that? And so we have these warnings. We have science. We know what it does. We know what it does to unborn children. We know what it does to young children. We know why. But do families know what to do when they get those messages? And sometimes the recommendations may not be practical. Because tell your 4-year-old to stay in the house and sit down with the windows closed. Good luck. But at the same time, I think what we can do with that information, then we can communicate that. Here's what we should be doing. Now we can activate communities. This is why we need to make changes in enforcement and regulation so that when we have an administration that says we're going to deregulate everything, there's pushback. Because the community understands, well, what are the complications? What are the ramifications of not having regulations? And I have to now entertain a 4-year-old in a closed house when I don't have those resources.
So having data available is not enough.
Not enough.
Making data get to action and interventions by the community and with the community together is what you're saying we need to do.
That's what I'm saying we need.
So Liz, my area of research is looking at the cumulative impact of chemical and non-chemical stressors, particularly on pregnant women and women of reproductive age. And when people ask me, so where have we not spent enough attention? They often expect me to say some kind of chemical or some kind of, I focus on the non-chemical stressors because the example that you gave about the child with asthma, when we did, supported kindly by NIHS and others, after Hurricane Katrina, we looked at children with mild and moderate to severe asthma and where their visit increase in hospital visits from the mold exposure. Yes, that was the #1 reason. We had increase in visits to the emergency room. But the #2 reason was losing a pet or changing schools twice. And so the psychosocial impact is profound. As a pediatrician, where have we made the least progress and what should we do?
Oh, okay. Where have we made the least progress in terms of women's health and also thinking about during pregnancy and in the postpartum period and children's health? So least amount of progress, I think, is in supporting the healthcare delivery system to really authentically address the social drivers of health. So one of the things that we are starting to see is more and more what are called SDOH, the social determinants of health screening, that are now embedded in a lot of our electronic health records, and CMS is now, our Centers for the Medicaid, Medicare Services, right, is saying that they will reimburse, right, for these screenings. But it is doing screenings without actually having any meaningful partnerships with our, to be able to actually do closed loop referrals with a food pantry, transportation assistance, legal services, housing assistance, and so on and so forth, right? And so there are pockets around the country where there are some really model examples of community partners being integrated with the healthcare delivery system with formal partnership agreements, with ability to get reimbursed for doing the work, right? It's not enough for me as a pediatrician to say, oh, I've identified a food insecure family, major stressor, right, for all the things, and refer them to the food bank, but the food bank never sees a penny for supporting my patient, right? And so that there are these real challenges where we have continued to ignore our role as the healthcare delivery system, right, in perpetuating these inequities by not being good partners and recognizing the extent to which community organizations provide hidden support for our patients and families. So I think that is one area. It's both an area where we've not made a lot of progress, and we have huge opportunity, and we have huge opportunity in our region to do this in a much more just and equitable way. I think the other, and this is sort of turning the lens onto the university, where we have really tripped a lot, is that we continue to persist with siloing, right? Dean Lichfeld runs the School of Public Health. I'm in the Department of Pediatrics. There's very little incentive within the university for us to collaborate. We do anyway, because that's how we know and we love doing that. And because, and this is just getting into the weeds, but it's the kind of things I think that we're at a place where we need to be really digging deeply into figuring out these barriers, is that my boss is much happier if I write a grant that brings overhead costs into my Department of Pediatrics. That means collaborating within the Department of Pediatrics. But if I collaborate with the School of Public Health, we have to actually split those overhead costs, right? That's a problem. And we have to, as academic institutions, be able to incentivize transdisciplinary collaboration, right? Beyond just talking about it and relying on scientists who understand that collaboration makes our science stronger. And so I think those are areas that are both places where we continue to trip and areas where we could really move the field very rapidly forward.
So we've heard breaking down silos, looking at what's happening in our own world, making sure communities can take actions, and breaking down the other kinds of silos so that we could truly incentivize the transdisciplinary work. In the next 15 or so minutes, questions from you for our panel members. It's really tough to see if there is a microphone, or please. Yep.
Hi, good morning. My name is Sarah Munyoki. I'm a postdoc here at Magee. I think, most of the panelists, a word that has come up a few times is sort of like taking a transdisciplinary approach to this. And Dr. Solomon sort of, in her talk, mentioned how some medical schools are starting to educate their clinicians when it comes to this. And for me, as a trainee, I'm thinking, and a basic researcher, what's the opportunity for transdisciplinary education for us, so that as I go on to sort of like start my own lab and my future career, that I am empowered with the tools to be able to actually contribute to solutions to these problems, right? And maybe this is more for Michael at University of Pittsburgh. Like, what is there, what does the landscape look like in terms of like educating future scientists on the environment and integrating that into our education and training?
So Michael, and then I'll add. Go ahead.
Yeah, so it's a fantastic question. We this started as a School of Medicine effort, and again, I said that it changed into a health sciences-wide effort because the curriculum doesn't really need to change that much when we're talking about this. And I also think it represents this fantastic opportunity. We hear about transdisciplinary education all the time, but it's hard to build that in, and our students are actually driving the change very often. They know more about the issues that we're talking about this morning than our faculty do. And so we are actively working. That really is one of Dr. Wood's jobs, and a job of staff in our office, Corey Flynn, to work to actually create those interdisciplinary groups. So we have a meeting of students right now that is across all of the schools, and then to modify the curriculum so that you're armed with the tools. I really have to go back to what Dr. Miller said and say that in a research environment, we are all, it is your mentorship and it is the team that is around you that actually then empowers you to go forward. And so we absolutely have to continue to drive the transdisciplinary research mission as well. But I think that this is all changing for the positive. and that, give us a year. We've moved up in our planetary health report card, so there's a way that we can measure this from a D to a B, and we need to continue to drive forward on those efforts.
So let me add concretely what we're doing in public health. We're putting our money where our mouth is. We are in all public health. We have a public health science academy where we go to Pittsburgh public schools. We juniors and seniors in high school can apply, and they spend 8 weeks with us in three areas: climate, environmental justice, and maternal and child health. What's actually came together this morning here. And so they are, after they leave, and the research and the practice areas in communities like Jamil's, what they're doing, you would think they were a year or so with us. But the point is that they then go into, and we're opening the pathway to college in general and public health specifically. Across the nation, we have a support from the Center for Disease Control and Prevention to bring in college students, juniors and seniors in college, to be with us for 8 weeks in the same kind of summer span, so that they, again, focus on those three areas, so that they can take that learning early on and move it in to their graduate education, all to help us diversify the workforce in a way that is transdisciplinary. And then lastly, I'm currently co-teaching a course in climate and health, and with Dr. Shekhar's emphasis on bringing that joint learning and transdisciplinary learning, as Mike said. Also online, we're hoping that as a postdoc, you can join us in the summer, but also as part of a CME activity. On the questions.
Can I get a quick
Yes, please.
comment? I love the question. I just wanted to say, I think we need to break the medical school students out of the walls of the medical institution. When I look at the Sheet Metal Workers Union, the Carpentry Union, and the Penn State Master Gardeners Association, all of those succeed because of pre-apprenticeship and apprenticeship programming. Mm-hmm. What we need is apprenticeship programs for medical students to get out of the medical school. An hour and a half from here, you have massive climate and economic justice areas in West Virginia and rural southwestern Pennsylvania. It would be incredibly straightforward to take the community organizations there, place medical students there for a summer, on the ground doing real work. Nothing beats closing the geography gap and showing them exactly what's happening next door, where 96% of the children are living in poverty. 96%. And if you look at them and you spend time with them and work with the advocacy organizations, I think it'll put a whole new lens on the eyeball of that medical student when they come back and finish their degree.
So we are starting an MD MPH program to do exactly that.
Good.
Please.
Excuse me. So you talked about how fostering community...
Could you introduce yourself, please?
Oh, sorry. My name is Alex Bauer. I'm working in the Sadovsky Lab on working on social determinants of health and how environmental factors and demographic and physical factors all play into maternal outcomes. And so I have a little bit of experience working with people that are looking to do community outreach and fostering information that is actionably insightful. And so I heard you talk a lot about how actionable insights are critical, and that without them, we can't really see true change, and that also community communication is the other factor of that, is that trust within the community has to come from the community. It can't come top down. It's a very lateral process. So how can we as a community take action in fostering community information, and how can we be informed, stay informed, and provide actionable insights to members of our own individual communities? Thank you.
I learn from communities every time I take my students there. I learn from communities when we can earn the trust, right? And so, Jamil, you're at the forefront of that.
Right.
How can we learn more from the communities?
And so much of it is being in relationship and being in the community. And that's what it's built on. I'm going to share with you as much as, it's going to stop when I stop trusting you. And so the amount of information that we're going to exchange is going to be based on that relationship. And so when you show up Okay, that's nice to meet you. Show up again, show up again. Now we're starting to establish a rapport, and we're starting to see each other as people rather than as outsider, insider, or subject, expert. And so it's about those relationships. And then you start to understand, well, what makes you tick? What makes, how does that work? What can we do to each other? How can I support you? And so that's where the learning comes from, out of the relationships and the time that it takes to make those relationships.
Yeah, in disaster preparedness, we always say during a disaster is the worst time to exchange business cards.
That's right. That's right. Can I add a couple more suggestions to
And
that?
then we have one more question.
Absolutely. So that one of the very concrete things, and this also answers your question about, as a postdoctoral fellow, what opportunities do I have? So Dr. Sadovsky knows that I obsess about making sure that our trainees have community mentors. So these are people who are paid. Dr. Bay has served as a community mentor for one of our early faculty, as an example. But they meet once a month to talk about getting connected to other community networks and thinking about how to translate research for impact. And community mentors get paid for their time because they're serving as educators. Another example of this is our medical students for the last couple years now have been going in small groups to community organizations through a program that's called the Community Alliance Program. The medical school at University of Pittsburgh is paying those community organizations as educators, right? I think it's really about helping to shift the lens so that we really appreciate how much community members have to teach us. And then there's a third piece of this, which is returning research results to participants and to community members. We do not do that enough. We often will publish in our research publications and move on and not take the time to really make sure that we have gone back and translated what we learned, again, from and with participants and then with community members. And it just continues to break my heart every time our team goes back to return research results, which we do regularly, that community members will say, wow, you're the first person from Pitt who's ever come back to talk to us about the research. And that needs to change.
A lot of ways to go, please, in the next couple of minutes.
Good morning. I'm J.D. Leger, and I'm a PA student graduating with the University of Pittsburgh and with the intent of going into women's health. The question I have, we live in a very polarized country, polarized world right now. Due to confirmation bias, the message that you are all delivering is being heard by those that already support the cause. How do you deliver that message to the other 50% of the country and have it be heard and acted upon?
How do we preach to the non-choir?
I mean, listen, I think that that words are important, and that, we heard this morning about the trusted level of healthcare providers, right? And, we'll call nurses out for being a level above the doctors, right? I think that we have to make sure that we're educated internally and therefore can speak to the issue, although you don't have to be an expert to speak to the issue, is one of the things. And then I do think we have to be careful about the words we choose and the message we're delivering. Another thing that came across this morning, I've just heard these points, right? When you talk about people's children and you talk about their grandchildren, when you talk about pollution, and avoid what has become political terms, but you talk about pollution and the air we breathe and the water we drink, it's a way for us to break through. So we might be in the minority of people who care about this problem based on the recent results, but that doesn't mean that when we visit with people and we talk about a plant-based diet and its health, and we talk just in those terms, that we can't make a difference. So I think this group has the ability to make that type of change.
Thank you. So we have 1 minute and 53 seconds left. In that 1 minute and 53 seconds, I'm going to turn to you, Ilya, and say,
Too much pressure.
what's the one thing Joel wants to give him so that his summit is even more powerful next year? What's the one thing that we can do?
I'll answer the question. I'll do it by going back to the question that was just asked, because I am frustrated to no end at the lack of us being able to move the needle on public discourse in general. I have tried talking to presidents at Davos. It doesn't trickle down. I have tried talking to, sorry, problem with my emotional state here. I have tried producing mass media visualizations. It doesn't get taken up. We've tried scaring people by having multiple hurricanes blow through, many wildfires blow through, houses demolished, and they don't connect the dots and decide, oh, this has become an emergency, this is a crisis. The only thing I've seen succeed, the only thing, and it succeeds swimmingly well, is that every time I teach a freshman class, like right now at Carnegie Mellon, not 50%, not 70%, 100% of the undergraduate freshmen care deeply about this. And you can tune into the presidential debate, and climate change is not even, and women's health is not even in the back seat. It's not even in the trunk, right? It was dismissed at the presidential debate by both parties. So the adults in the room are failing at this, fundamentally. But the children, the freshmen that I deal with, they're all about this. They have no interest in going to JP Morgan Chase and making $1 billion or going to Google and working on ad revenue. They want to make the world better, and they believe that we have failed them. So I believe what we need to do is massively engage, educate, and motivate the incoming students, because as far as I can see, they are far more progressive on this issue than all the adults in the room.
Mm-hmm. I started at high school. I want to start in middle school. You can't start early enough. What's the one thing you want Joel to do?
Love to see this as a recurring theme. I think that the getting as many students in the room, I have to build on that. I told you we're learning from the students, so making part of this empowering the next generation and a concerted effort, I think. And listen, what an amazing start. What an amazing theme. I just could not have imagined something framed better. So kudos to you to putting us all up here in the first place.
Jamil, how do we let the child with asthma actually be our spokesperson?
I think get the community here. How do we make the community as a part of this conversation?
Next summit.
Yes.
Mm-hmm. Thank you. Liz, what's the one thing you want Joel to do?
So my one thing would be to actually have a track for us to have youth and young adults at the summit next year. We actually do have an example of that, the Global Eradicate Hate Conference that is, happens here in Pittsburgh. Now for the last 2 years have invited area school districts so that every one of them has an Eradicate Hate Club happening. We could do the same thing here as well.
Please join me in thanking this exciting and wonderful